Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to Between Two White Coats. And today we have a very special episode. We've never done anything like this before.
Never done this.
And we also have our lovely Elizabeth, which you will not see but hear today. And Elizabeth is our marketing manager, and she's fabulous and makes the podcast all the things that it is. So we are so excited. So this is just like, we're just...
Amber put out into social media, ask us anything. And we have intentionally not looked at any of these questions or prepared for them. So this is all off the top of our brains. This is very much what it feels like to be at a dinner party if you are a doctor or nurse practitioner, because people will start with, do you mind? I know you're not at work, and you're like, ooh,
this is going to get good.
What's about to come? And it is that moment that my husband walks off as fast as possible. And I know Josh does as well. So we're just at a dinner party.
Or he's always like, why? What is the deal?
Yes. So here's the Ask Us Anything, and you'll hear Elizabeth's voice as she reads off from our Facebook and Instagram what people would like to ask us. She is going to read it exactly as it is. So you can also appreciate how we hear things sometimes and what we do with it.
Awesome. Well, we're going to start out kind of tame. So we're going to start out with a question from someone asking, what are your thoughts on weight loss and the side effects of Zepbound? What's the best diet weight loss medicine?
Okay.
We get this a lot.
We do, yeah. And you know, it used to be a harder question because there were so many weight loss medicines, and they all helped you lose about 5 or 6% of your start weight. And then came the GLPs and the GLP-1s and the GLP-1 GIP combo, which is semaglutide and it's generic for GLP, tirzepatide for the combo, are so much superior to every weight loss medicine that we've had before. Yeah. So it's an easy answer that you've got to fall into the GLP categories if you're talking about good weight loss medicines now. They have not only been approved for weight loss. If you listen to our podcast, you've heard us talk about them a lot. If you listen to anything, you've heard about them. But approved for fatty liver, approved for diabetes, approved for
sleep apnea,
of course, for obesity and weight loss.
For someone who's overweight with a comorbidity like high blood pressure, hyperlipidemia.
And for preventing heart attacks and strokes. Yeah. And so when you talk about what happens in America, if we get rid of those things, you and I will be able to take vacations. Yeah. It will be profound. Yeah. That we don't have to do as much medical management when we can help people with those types of things. And we did a podcast on fatty liver and how that's increasing so much. So, you know, all in all, the semaglutide or tirzepatide, specifically this person asked about Zepbound. Mm-hmm. Zepbound is the weight loss branded version of tirzepatide by Eli Lilly. And I would say that it is the best for weight loss.
And there's new ones that are coming out.
Yeah.
And so we'll see how that kind of
stuff
shakes
around
out.
The corner. The reason I think tirzepatide is better than semaglutide is it has about a 5 or 6% greater weight loss, and some people tolerate it better. Was there a second part to that?
Well, it was
question?
diet, like what diet, and so anytime you're talking about weight loss, like we need to look at it from a whole body approach. Like, what are you doing? How are you eating? How are you sleeping? And so, from a dietary perception, is when you're with those medications, if you are not putting good stuff in, you're losing not just fat, but you're losing muscle. And so protein is huge. Let's make sure you're not losing muscle. And monitoring. So you can get a home scale, like the Whiz scales that you can buy on Amazon for $30. It's WYZE, but there's tons. I'm not sponsored by them. There's tons of them. Yeah.
But monitor your fat loss and your muscle loss so that you know what you're losing.
And we have the body comp here, so if someone's curious, they can come do that. And
yes, the gold standard is going to be body comp by DEXA, of which we have a DEXA scanner. And so I think eating your protein, making sure that you're lifting weights and exercising, being wise about your diet. And our goal in any medicines is always to use the least amounts that you benefit from for the shortest period that you need it, and then to try to come off of it. So if you're making good lifestyle change, you may or may not, but you may be able to sustain your weight without it. And so our goal would be first and foremost to make good decisions.
Yeah.
Awesome. Well, keeping in the same lane of Zepbound, someone asked, will taking Zepbound be effective if I have Cushing syndrome?
Oh, good question. And I think you can expand that to is taking Zepbound effective for a lot of things that cause people to be overweight. Yeah. And kind of picking back, Cushing syndrome is an adrenal insufficiency. It certainly is something that absolutely has to be treated. Yes. I'm sure if a person knows they have Cushing syndrome, that they are with an endocrinologist and that they are being treated for that. And if you are treating your Cushing syndrome, would Zepbound be beneficial? And I would say yes. Yeah. I think Cushing's, like so many things, thyroid disorder, menopause, is a reason why people gain weight. Yeah. There's a lot of medical sleep apnea. There's so many medical issues that contribute to weight gain. And just because, and this is the unfair part of it, just because you get that underlying thing fixed doesn't make the weight come off. It might make you stop gaining, but it doesn't make you go back to the weight before you had Cushing syndrome. Mm-hmm. And so many times we have to do something to help you get that weight off. You have something in your body happening that's making it harder to lose weight, even when you attempt to get it controlled. So I think using Zepbound when you have Cushing's, once your Cushing's is well treated, is a great idea. And I would hope that your endocrinologist might be able to assist you in that.
They'll probably get it approved sooner than we can do.
Maybe so, yes.
Another GLP-1 question, berberine versus GLPs.
Good question. I think that it is, why are you taking it? What is your motivation? The reason that I don't like when people talk to me at a dinner party about something is because I'm going to answer the question that they're asking, but
with another question.
Typically it requires 5 more questions to make sure that we're, doing them a good service, because everything is so different. And so, there's often times more questions to ask, but the question I would ask to that is, what is your motivation? What are you hoping to accomplish with GLPs or berberine? Mm-hmm. If you have an underlying insulin resistance, the beginning of a metabolic syndrome, blood pressure, PCOS, there's lots of reasons why people do these medications on and off label for the GLPs. And berberine, for those people who aren't familiar, is a supplement. Yeah. And it's a supplement that we found really helps with early insulin resistance and some early metabolic syndrome. It helps, people just kind of regulate their sugars and insulin better. But
it doesn't take the place. I would say that. Like, it doesn't work like the GLP-1.
Have you ever put anyone on, and I've recommended berberine for a lot of people. Have you ever put anyone on berberine and seen dramatic weight loss?
No.
Me neither.
I would say, I think the most I've seen is about 5 pounds, but that's in conjunction. Like, they were maybe at a plateau and I was like, hey, let's add some berberine. Yeah. It's a natural supplement. Let's try this for the next month or so. Yeah. And then usually in their 3-month follow-up, because I typically see my weight loss patients about every 3 months, they'll have lost 5 additional pounds. Yeah. So then I'm like, is that berberine, or is that because you're making better lifestyle choices?
I will say I've had people tell me they feel better on berberine, that their fatigue is better, that
because it's anti-inflammatory as well.
That they aren't hungry and craving sugars as much because maybe they're less insulin resistant. Yeah. But it's a supplement. It's kind of slow and steady. It's not a real powerhouse. We like it. I think it's safe and effective, but it depends on what your motivation is. If you don't have weight to lose and you're just really trying to combat some insulin resistance, PCOS, get your hormones optimized, I think it's a perfectly good idea. and you may feel better on it. And what I typically tell people about supplements is buy a bottle and take that bottle and pay attention to what your goals are. And if you're achieving those goals, then stay on it. Mm-hmm. And if you're not, then don't keep spending money on something that's not getting you to goal. Mm-hmm.
All right. Somebody asked, I went to Dr. Google today.
Oh, Dr. Google is busy. We love that guy. That guy sees a lot of patients.
He does. She said, for terrible night sweats and itchy skin, like clawing because I'm itching so bad, I'm taking 1 milligram of estradiol for perimenopause / PCOS. I'm not sure which is causing the low estrogen. I'm 43 years old. Google told me I could have anything from leukemia or low estrogen. Help.
Oh my gosh, I love this patient, and I hope she comes to see me because she sounds like so much fun. And I love when people joke about Dr. Google, but the internet is a good resource, and you just have to know, how to apply it. And I love when people Google stuff because they typically get a visit right away because
they think they're dying.
And I'm dying, and cancer is always in the differential diagnosis. And so, first of all, when you are clawing your skin because it itches so much, you need a doctor whose last name is not Google. And let's figure out what's going on because that sounds miserable for you. And I'm sorry that you're having to go through that. And so
itchy skin can be a lot of things.
It can be a ton of things. And if we were trying to Occam's razor this, which is, can we find one cause for all the stuff, then 43 is a little bit young for estradiol, but and she's already on estradiol.
Yeah.
So
and 1 milligram, and she has PCOS, and sometimes, oral estrogen goes to the liver. So I don't know that would be the best option for her. It might be what they've talked about. And
does she
is she on progesterone?
Did the itching start before she started the estradiol or after? Because if it's having an effect in your liver, that can make you cause itching. What were your labs prior to starting the estradiol? Do you actually need it or not? I certainly with PCOS don't typically go, that's an estrogen foremost. It's often other hormones as well. You bring up the good point. Are you on estrogen and not progesterone? Because if you have a uterus, we need to make sure that we're protecting your uterus, or are we balancing your hormones okay?
Or do you have really bad eczema?
So, right.
Or some sort of true skin condition.
And I want to see your skin to see is there, something going on with your skin. But if we were to say, is this, let's assume that we had answers to any of those questions and we're calling this perimenopause. And even are you perimenopause? Have you stopped having periods for a year? Or will we ever know because of your PCOS? Maybe you're already amenorrheic. But if this is perimenopause, then I think maybe getting some hormone levels would be a next good step. Optimizing your hormones to see if it helps, particularly since you're having hot flashes as well. However, hot flashes can be a lot of things.
Be your
and
glucose.
Menopause is having a moment, and I'm grateful that we're talking about it. And I'm grateful that women are finding their voice to say, hey, I have stuff and people should listen to me. And yes, absolutely, we should be listening to women with stuff. Sad that we weren't at whatever point. However, itching and hot flashes, do you have some febrile disorder? People can get hot and have night sweats. Like night sweats is an ominous symptom for cancers.
I'm freaking out.
And cancers can cause. So not only is Dr. Google convincing you you're sick, so am I. And I'm not saying you have cancer, but I am saying that there are questions to be answered there. I like that she's thinking and advocating for herself. Get in front of somebody so that, and if you're in this area, just call us up. Let's get a visit because I think there's more questions that we want to answer, and I think that this can be helped. Let's make sure it's not something significant. And if it works out to where it is hormonal, I think there could be some adjustments to hormones and we'd see if your symptoms improve.
Yeah. Awesome. Well, on the other end of the spectrum, we have a sweet lady with a question. I'm 63 and now in postmenopause. My hormones are really off, but have no other symptoms other than body aches at times. Do you have any suggestions for natural supplements?
Good question. And this does make me want to just have a little conversation around the women who are postmenopausal now and they didn't have their time.
It makes me sad for them.
It does. because when we are in menopause is when we want to start treating the hormones and replacing the hormones. And that's when we get some of the protective benefits as well. 10 years post-menopause, which 63 for most people would be 10 years post-menopause. There are people in their 60s and 70s who are saying, what about me? Why can't I be on hormones? The research does not support the protective benefits the same when you are 10 years post-menopause. So that being said, I love that she's saying, what about some supplements? Because I do think if you're 10 years post-menopause, you don't want to jump to put me on the hormones too. Yeah. That deserves a conversation, but what would be some supplements that would be a good idea?
Well, she was complaining of joint pain. So anything that would, like fish oil is great for joints. Yeah. Glucosamine is good for joints. Those are just natural supplements. Like, is it arthritis? Are we sure it's, maybe it's not hormone, maybe it's osteoporosis?
Right.
Like, do you have an updated DEXA scan?
And when you're postmenopausal, do you want to make sure you're on a good vitamin that has a lot of good D and calcium in it to protect your bones? So I'm not saying that's the underlying cause of your symptom at all, but it would be a good idea to make sure. I like Pure Encapsulated's women's nutrient because it has a lot of it's for women over age 40. It's good for your vision. It's good for your heart. It's good for your bones. It's just optimizes a lot of things. So I like that as a supplement.
And we're not saying that hormones are not a hard no.
Right. And if you wanted to optimize your hormones, DHEA sometimes is a precursor to some testosterone. So if you want a little more energy or a little more libido, DHEA could be something you could consider as a supplement. There is a supplement called DEM, and DEM works on your liver, and it helps kind of clear out excess sex hormone binding globulin so that the hormones that you do have are more free and active. So if you're trying to optimize hormones, those are some options. Yeah. But all of this being said, I think too, looking at the whole picture, which I know is kind of
not fair for the question.
We have more questions. We can answer the questions, but the answer is always two. There are probably some even more specifics that we could get into, and knowing what medications you're on and things of that sort.
Awesome. All right, a little bit of a long one. Our friend said, they're asking, my daughter started experiencing mood irregularities within 2 months of having the Nexplanon birth control implant. The OBGYN put her on Zoloft to regulate her mood. Within 1 week, she turned into a zombie and started having suicidal thoughts. We removed the implant, took her off the Zoloft, started therapy, and had a full metabolic panel done. Her vitamin D was 11. Due to suicidal visions, we took her to an inpatient therapy at a behavioral hospital where she was misdiagnosed, and they put her on Zyprexa. She had horrible side effects, and we weaned her off, but that came along with the withdrawal symptoms. It's been a month without the implant and 1 week off of the Zyprexa, but she's still not back to normal. How long will it take her body to rebound from this? She's been out of work for over a month.
It makes me want to cry.
I know.
I got teary-eyed thinking about it.
That was my first thought. I'm so sorry for what you're going through, and I'm so sorry for what your daughter's going
through. I mean, your daughter's working, so I don't know how old she is, but in my mind, I was thinking Nexplanon, so I was thinking maybe late teens, early 20s is my guess.
Early reproductive years, late.
So
early
I have
20s.
so many more questions about that. So with the Nexplanon implant, and I don't know, did you say mood irregularities first? Or menses irregularities?
It was mid. The OBGYN put her on Zoloft to regulate her mood as a result.
So it sounded like, if I were to summarize, Nexplanon, which is a insert in your arm that is progesterone only, birth control. And then because of the progesterone in it, it seems like it affected her mood, and which progesterone can do. And so then, because the Nexplanon's already in, it's not a pill that we can quickly say, just stop taking it. They tried to regulate the mood with Zoloft. And Zoloft, although very rare, has a black box warning of suicidal thoughts.
And so does all SSRIs.
All SSRIs in teens. And so we don't know if this is a teen or someone older. And it could have been that the mood was getting worse from the high dose progesterone. And so it seems like then things went pretty south. So it's like, okay, you were assuming you were okay before we put the progesterone in and the Zoloft. let's remove all those things and see if you get better. And I don't
worse.
know how long it took, or how long, but it seems like got worse, ended up at a psych stay.
Which, and I want to say, like, kudos for being proactive.
Yes.
And, like, taking that seriously. It makes me get all teary-eyed thinking about all the patients that struggle with mental health and don't have access to care.
Yeah. And how rough this is for this patient and this mom.
Yeah. All I can think about is a teenager. She might not even be a teenager. She might be a 35-year-old female, but I'm crying for her too.
I know.
It's a lot.
That is a lot. And it's frustrating because you went to get something medical and 90% of the time that's
it's just
not
fine.
what happened.
Yeah, it's just fine.
And then this all went south. And so all of this being said, I never want to say something that discourages people from a psych inpatient stay, because when things aren't going well, that's exactly where you need to be. That is exactly where you need to be. But psych medicines are sometimes not easy medicines. And so I think that the bottom line question is, when do we expect her to get back to normal? Or, what it was before all of this. And I would say that there's layers to that. First, Zyprexa is going to take a little while to get out of your system, and I don't know off the top of my head the half-life on Zyprexa.
Yeah, but then now the trauma
it's a long exactly, and that was my thought as well.
That's what I'm like. Oh
because
my gosh,
you've also been through some stuff, and your hormones have to get back to baseline, and that can take months.
90 days for hormones to recycle is typically what we see.
Yeah, so 90 days based on when you got the Explanon out of your system, then the Zoloft should be out of your system in a week or two would be my thought. Zyprexa, I would say a couple weeks. This is all off the top of my head. I'd have to look this up to be safe. But I think also meeting with a counselor, making sure that you're doing everything
and maybe
you
have
can.
a psychological evaluation too, just to make sure, even if it's just PTSD.
Because we could call the side effects of the medicines or other things, but is there more going on?
Yeah.
I think meeting with your primary to make sure we've got some labs and let's make sure everything's good. What you could possibly do to help promote getting back to clearing these medicines would be stay really well hydrated, drinking not an excess. You can drink too much water, but 80 to 100 ounces of water, getting good rest, eating a good diet, doing daily exercise, getting sunlight in your face in the morning, just trying to do the things that you can. Yeah. Getting into the talk therapy so that we can control the things that we can control while the medicine gets out of the system, and definitely meet with your primary care so that you have someone on board that can be making sure there's not more going on.
And close follow-up. Like, she may have a little hesitation to see medical professionals now, but having close follow-up I think will matter a ton because of what she's been through.
Yeah.
I was not expecting that to make me cry. Any questions to make me cry, but that was heartbreaking. That's hard.
Heartbreaking.
That's
I'm
hard.
sorry. I'm sorry for what they're going through. That's hard.
All right, we have about 2 more questions. The next one is from someone wanting to know. They said, I'm learning that diet and gut health play such a major role in our health. Having Hashimoto's hyperthyroid, I've recently found that so many foods are making me worse. Unfortunately, I did have to learn this from Dr. Google and social media platforms. So I guess my question is, why don't doctors address diet and nutrition more importantly, food sensitivities when there's an autoimmune disease present?
Yeah.
Honestly, I've asked for help with nutrition, but was told it wasn't offered. I believe this should be a high priority.
It should be a high priority, and I can quickly answer as to why it's not. Insurance doesn't pay for it. And we try to refer people to things that insurance doesn't pay for, and the answer most of the time is no, or they can't afford it. And so if insurance did better, we could all do better. Nutrition is hugely important. Another issue is that doctors get about 1 week of nutrition education at most. And so it's not an area that's emphasized to us. And if we're not trained on it, 13 years of higher education I have and 1 week of nutrition, how much do you think I'm going to actually lead with that? And I care about it probably in a way that some doctors don't.
Well, and I think that like I have celiac, so I know like autoimmune issues with your stomach. And so I will often, even for my Hashimoto's patients, but it's because of my experience, because I have celiac. So I'm leading with that often to say, hey, if there's foods that are inflammatory and you have an autoimmune disease, you might need to steer away from those. But I feel like my case is a little different because I do have an autoimmune disease.
Yeah.
And so I know the importance of nutrition. So
I think the routes that are often successful for people now, depending on where this person is, what their accesses to things is naturopathic doctors and functional doctors. They do a lot more in the GI world. Unfortunately, traditional doctors do less in that. Amber and I typically would approach someone who has Hashimoto's of saying one autoimmune disease can beget other autoimmune diseases, celiac being one of those. I would be interested in this person getting tested for celiac if they hadn't, and also having a full allergy panel so that they knew what they can and can't tolerate. I would do that through scratch testing, not just blood work. And then I do think pursue the nutritional counseling. And if you can't get it through your doctor, naturopathic or functional medicine might be where you can.
Awesome. All right. We have time for one more question, and it's 2 in 1. It's about lower blood pressure. So we're going to go with the longer question that involves beetroot. So this person
Beetroot's
asked,
really gained some popularity. I had a patient telling me last week how much they love their beetroot.
Well,
they drink it.
Get ready, because this is the question. Why doesn't your doctor tell you about beetroot for getting control of your blood pressure? When you see your doctor and you tell them about your aches and pains that you're having, for instance, you're on blood pressure meds and you're having severe aches and pains in your back and legs, and you know the side effects from the medication, but you don't let them know about the side effects and they suggest trying another medication, does beetroot help with all of this?
That's a layered question.
It is. So beetroot does a number of different things, and root vegetables have a lot of different good nutrition to them. Beets increase nitrous oxide. Nitrous oxide's a vasodilator, and so nitrous oxide is actually a prescription. Why your doctor doesn't tell you about beetroot but might talk to you about nitrous oxide or other things that are prescription drugs is because there's less research on the natural things. There's less evidence that supports it. And it's not taught to us in all of our education.
And also too, like if a patient comes in with a blood pressure of, 200 over 110, I'm not thinking beetroot, I'm thinking stroke.
Right.
And so like our training is, we have protocols that we follow, and JNC8 is one of the things. And so like what blood pressure medication that can we get this patient blood pressure down safely? Now, do I care about if you do beetroot later? Probably not. But you also need to do like the diet and exercise, and like mentioning aches and pains, like 1,000%. Could that be a side effect of a medication? Yes. Could it be that you have tight hamstrings because you don't exercise? Probably.
Could it be that you are ate up with arthritis?
It is, yeah. Like, so I feel like not that it's not the medicine, because there are medicines that have side effects of that, but I feel like that is there's a lot of things that cause aches and pains. But there's also ways to treat that. And if the blood pressure medication is doing that, and you can be on beetroot and maintain your blood pressure, by all means do that. But I don't know if that's the safest.
If anyone's listening and saying, hey, will beetroot control my blood pressure? I think you make a good point. If you have upper ends of normal, then dietary changes, including beetroot, will probably help get 10 points off of your systolic, but probably not 50 points off of your systolic. Even one blood pressure medicine is not going to do that. You normally have to do multiples. And so it depends on what your situation is. I do think that empowering yourself with the internet and a number of other things to be able to say what are natural ways, and then talking to your doctor. And one of the reasons your doctor doesn't bring certain things up to you is because there's limited time and a lot of options. And so we're going to throw out the ones that we think. And if you learn something and you want to talk more about it, bring it up to us. Come into a visit. And I have patients all the time who are like, here's the supplements and here's something I read on, and what do you think about this? I have people who print out research and bring it to me. I love that. I'm happy to. I don't know where your interest lies. And some people I might say beetroot and they might be, she's a quack. And then other people are like, why are you trying to give me all these prescriptions? And so, let me know where your interest lies and what you want to talk about, and we'll dive right in.
Awesome. That's all the questions we have for today.
All right. Well, I would say for Ask Me Anything, I was thinking that was pretty tame. So thank you. Thank you, people who sent in questions.
Made me
Great
so
questions.
sad. Made me happy.
Yeah, that was fun. That was a lot of fun. Thanks for joining us.
We like to leave you on a good note. So here's today's Tell Me Something Good. Something good is being heard. Truly having someone hear what you're saying and respect it. So many times people just want to be heard. You don't have to fix it, just listen. Thank you for joining us, and until next time, take care of yourself.